reason why we lose a lot of our babies, a lot of our children, is we get to hospitals late. And so there needs to be more hospitals by the government, by NGOs, by private sector entrepreneurs, because we need to create more access. That means we need to have services that are easier for people to come through, go out, because it's this long wait, or the high cost of care that keeps patients. So our mothers need to be worried if our children are irritable, if they have a high fever. Any child that has a fever more than 37.4, when it comes to children, must go straight to the hospital. Don't wait for it to get to 38. It's the adults that can wait a bit later.
Well, regular medical checks, healthy diet, and being physically active are some of the activities that promote good health. But how often do you incorporate these activities into your daily living? On our Focus on Health tonight, our correspondent YOMI OTAIGBE reports on why your health should be a matter of great importance.
The daily hustle and bustle. At the start of the year, many look forward to improving their careers, businesses, academics, and basically plan for a better year. However, some of these plans may inadvertently not include health, which can be described as the main driver of other plans. What plans do you have for yourself?
My plan for myself is very great. Like, I want to buy a car, I want to be a field, I want to be the house, a lot.
For this new year, I'm planning to maintain my spiritual life with God and strengthen it. I also want to develop my family life and social life. I need to be more social, have a good network, and the family, my health wise, I think I need to boost my health, trim the fat and stay fit.
We pray to God that all God should help us.
It doesn't take much time to assess your health, and there are various categories of a health checkup. For instance, you could just go into a hospital, ask the doctors or the nurses to check your blood pressure. To do that, you just need a few minutes. You can also use the same opportunity to check your temperature, to check your weight, to check your height. With that, you determine, am I an adequate weight for my height, for my age? You check your blood pressure, is it normal? You can use the opportunity to also check your blood sugar within a few seconds. Is my blood sugar normal? And you can check the urine, because the urine also mirrors many of the events going on in the body.
Getting more active and setting realistic goals are also some ideas to consider, as sedentary lifestyle and stress have been pinpointed as risk factors for some medical conditions.
Coming on with weight, you have several other diseases: obesity, hypertension, arthritis, diabetes, ulcers, even cancers. All of them come on with additional weight. And that is why a person should not live a sedentary lifestyle. Try to have physical activity. At least 30 minutes brisk walk 3 to 4 times a week.
If you stress up, then one may become a psychiatric patient. Okay, you may not be able to sleep. The neurochemicals in the brain may be activated, and before you know it, the brain may be rewired into another way. If you talk of the heart, stress, of course, is not palatable to the system, in the cardiac system, and that can lead to hypertension. If you talk about the musculoskeletal system, if you get worn out and if you stress yourself so much, the muscle will complain, the bones will complain.
For an individual to define his health as good just because it's up and good to go can be misleading. A stitching time is set to save 9.
So many people in this country are afraid of checking their health status. Why? It's either they are afraid that it may be positive. For example, there was a time we wanted to screen some people for cancer, and it was supposed to be a free stuff, but people ran away because they were saying, what if it was positive? Prevention is better than cure, is cheaper than cure. If you are afraid of that condition, what if you have it and they now tell you that this is at stage 3, stage 4? You will live, one will be more sad that you could have nipped something in the bud than denying it, suppressing it, and just moving ahead. The fact that you are working does not mean everything is all right.
It's a new year, it's a clean slate, and another opportunity for you to put your health high on your priority list. So, what plans do you have for your health in 2014? YOMI OTAIGBE reporting for Channels Television News.